Mechanical lifts are devices used to assist with transfers and movement of individuals who require support for mobility beyond the manual support provided by caregivers alone. They include floor lifts, sit-stand lifts, and ceiling track lift systems. Its purposes are the following. 1. To ensure safety of patients, residents during transfers with the sit-stand lift to and from a variety of surfaces including bed, wheelchair, toilet, commode, tub chair, tub stretcher, etc. 2. To reduce the potential for injuries to both patients, residents and staff.
Activities that use lifts to avoid sustaining a back injury. Lifting from floor. Bed chair transfer. Lateral transfer. Lifting limbs. Toileting, bathing. Repositioning. Posture and body mechanics. Avoid bending at the waist whenever possible. Maintain the arch in your back. Work as close to the patient as possible. Reduce the lever arm effect. Preparations. Before performing the lift, always read the care plan. Check for the patient's physical capabilities and medical condition. Make sure you have correct lift and sling for patient's condition and the lift will not make the patient's condition worse. If patient can assist with transfer, patient's weight, and physical condition. If alert, ensure patient is able to understand and follow instructions. The use of a patient lift should be avoided if the patient is agitated, resistant or combative. Check the equipment. Mechanical lift wheelchair for safety procedure. Ensure battery is charged for transfer. Test lift controls before bringing lift to patient. Make sure the emergency release feature works. Ensure receiving surface is stable and locked. Ensure slings, hooks, chains, straps and supports are available, appropriate, and correctly sized. Check lift and sling weight limits, and ensure patient's weight does not exceed the limits. Do not use sling with any signs of wear. Transferring the resident from bed to the wheelchair. Remember, if resident needs support, raise any side rails and have resident hold onto rails. Raise the level of the bed to the highest position before moving the resident onto the sling. This will reduce strain on the caregiver's back. Always communicate whatever you're about to do. Roll resident so she/he are resting on their side. Put the folded sling behind resident's back and roll onto their back. Pull the leg loops forward and under the thigh. Cross the loops. Roll the base as far under the bed as possible, locating the cradle over the resident. Be careful not lower the frame onto the resident. Hook loops of the sling to the spreader bar, ensuring that the loops of the sling are secured behind the safety clips. Loops should be the same color for each side at each of the locations on the loop. Shoulders, hips, and legs can be different colors, but both sides have to be the same color at each location. The parking brakes, caster locks, should not be on when lifting the resident. Let the lift move a little with the weight adjustment. When both sides of the sling are attached to their respective sides of the cradle, raise the resident slowly. If patient is in a hospital bed, it will help to raise the head section slightly. Raise the resident until buttocks are just above the mattress. When the resident is clear of the bed surface, swing their feet off the bed. Using the steering handle, move the lift away from the bed. When moving the resident, lift away from the bed, turn the resident so that he/she faces assistant operating the lift. The self-leveling cradle will bring patient resident into a sitting position. Move resident into position over the seat of wheelchair. Make sure wheelchair brakes are on. Press the down button, lowering resident so that his/her feet rest on the base of the lift. To place the patient resident in the best seated position, one staff may push on the knees from the front and the second staff may grasp the sling from behind or from the side to ensure the patient resident is seated as far back as possible to achieve a correct position. Ensure patient resident is seated properly prior to unhooking the sling loops. Remove the hook attachments from the lift and remove the sling from under the patient resident if indicated in patient resident care plan. Ensure the patient resident is in a safe, comfortable position before leaving the patient resident unattended.
It has to be closer to her inner thigh. Back.